It's 3:45 in the afternoon, and you're sitting at your desk when that all-too-familiar, sharp, burning sensation suddenly flares up in your upper abdomen, like someone just lit a match inside your stomach. You instinctively reach for your water bottle, thinking that maybe some liquid will help wash away the burning pain. So you take several large, cold gulps straight from the refrigerator, expecting relief but instead feeling the burning sensation intensify and spread up toward your chest, making you wonder if you somehow made things worse instead of better. This scenario has probably played out countless times in your life since you turned 40, and you've likely been told by well-meaning friends, family members, or even healthcare providers that drinking more water is good for gastritis, that staying hydrated helps with digestion, and that water can dilute stomach acid and provide relief from burning sensations. While there's some truth to these statements, the reality is that most people over 40 are drinking water in ways that actually worsen their gastritis symptoms rather than relieving them, and this seemingly innocent mistake is contributing to chronic inflammation, delayed healing, and the persistent digestive discomfort that millions of adults experience every single day without understanding why their symptoms never seem to improve despite their best efforts. As a gastroenterologist who has spent over 18 years treating patients with gastritis and other digestive disorders, I can tell you that the temperature, timing, quantity, and even the method of how you consume water can mean the difference between soothing your inflamed stomach lining and triggering a cascade of inflammatory responses that make your gastritis significantly worse, particularly as your digestive system undergoes the natural changes that occur after age 40. What I'm about to share with you isn't just general hydration advice or basic tips about drinking more water throughout the day. This is a specific, medically designed water consumption protocol that takes advantage of your body's natural healing mechanisms and works with the physiological changes that occur in your digestive system as you mature, rather than fighting against them the way most conventional hydration recommendations do. The technique I'm going to teach you has helped thousands of my patients achieve rapid relief from gastritis pain while also supporting the long-term healing of their stomach lining. And the best part is that it requires no special equipment, no expensive supplements, and no dramatic changes to your lifestyle. Just a simple modification to something you're already doing every single day that can transform your relationship with gastritis pain and put you back in control of your digestive health. This isn't about drinking more water or different types of water. This is about drinking water in a way that your mature digestive system can actually use for healing instead of irritation. And once you understand and implement this technique, you'll wonder why no one ever taught you this crucial information that could have saved you years of unnecessary suffering. Before I reveal this game-changing water technique, I need you to think honestly about your current relationship with water and gastritis symptoms, because understanding your baseline will help you recognize the dramatic improvements that this method can provide. When you experience gastritis pain or burning sensations, what's your instinctive response? Do you immediately reach for cold water, thinking it will cool down the burning sensation in your stomach? Do you drink large amounts of water quickly, hoping to dilute the acid and wash away the pain? Do you sip water constantly throughout the day, believing that continuous hydration will prevent gastritis symptoms from occurring? Have you noticed that sometimes drinking water seems to help your symptoms, while other times it seems to make them worse, leaving you confused about whether water is helping or harming your digestive health? Do you experience bloating, fullness, or nausea after drinking water, especially when your stomach is already irritated? Have you found that certain times of day seem better or worse for drinking water when you have gastritis symptoms? If any of these scenarios sound familiar, you've been experiencing the consequences of well-intentioned but physiologically incorrect hydration practices that are working against your body's natural healing processes rather than supporting them. Please give this video a thumbs up right now if you recognize these patterns in your own experience, because your engagement helps me reach more adults over 40 who are unknowingly sabotaging their gastritis healing with improper hydration techniques. And every person who learns this correct method represents someone who can finally experience the relief and healing they've been searching for. I also want you to subscribe to this channel and hit the notification bell, because I regularly share advanced gastroenterological insights that go beyond basic medical advice to provide the specific, actionable techniques that can make the difference between continued suffering and genuine healing for people dealing with digestive disorders. To understand why the correct water technique is so crucial for gastritis relief after age 40, you first need to understand what happens to your digestive system as you mature, and why the hydration approaches that may have worked when you were younger can actually become harmful as your body undergoes age-related physiological changes. Starting around age 40, your stomach begins producing significantly less hydrochloric acid, the powerful digestive juice that's essential for breaking down food and maintaining the proper pH environment in your digestive tract. This reduction in acid production, combined with a thinning of the protective mucus layer that lines your stomach, creates a delicate balance that can be easily disrupted by incorrect hydration practices. When you drink large quantities of cold water, especially during or immediately after meals, you're creating a shock to your digestive system that causes several harmful responses. First, the cold temperature causes your stomach muscles to contract and spasm, which can intensify existing pain and create new areas of inflammation. Second, large volumes of liquid dilute the already reduced stomach acid that your mature digestive system desperately needs to function properly, leading to incomplete digestion, fermentation, and the production of gases that increase pressure and discomfort in your stomach. Third, drinking too much liquid too quickly overwhelms your stomach's capacity and forces partially digested food and diluted digestive juices up toward your esophagus, triggering acid reflux symptoms that compound your existing gastritis pain. The cold temperature also reduces blood flow to your digestive organs, slowing the healing process and preventing your stomach lining from receiving the nutrients and oxygen it needs to repair damaged tissue. Additionally, consuming large amounts of liquid when your stomach is already irritated can stretch the stomach walls and put additional pressure on inflamed areas, intensifying pain and potentially causing further damage to sensitive tissue. The revolutionary water technique that I've developed specifically for gastritis sufferers over 40 works by addressing all of these physiological factors while supporting your body's natural healing mechanisms. This method is based on 3 fundamental principles: optimal temperature for digestive healing, strategic timing that works with your body's natural rhythms, and specific consumption patterns that maximize therapeutic benefit while minimizing digestive stress. The first principle of the therapeutic water technique focuses on temperature optimization for digestive healing. Instead of drinking cold or room temperature water, you're going to consume water that's heated to exactly the right temperature to promote stomach muscle relaxation, improve blood circulation to digestive organs, and create the optimal environment for reducing inflammation and supporting tissue repair. The ideal temperature for therapeutic water consumption is between 98 and 104 degrees Fahrenheit, which is slightly warmer than body temperature but not hot enough to cause any burning or discomfort when consumed. This specific temperature range has been chosen based on extensive research showing that warm liquids promote vasodilation, increasing blood flow to the stomach lining and delivering more nutrients and oxygen to healing tissues. The warmth also has a natural muscle relaxing effect that can provide immediate relief from the cramping and spasms that often accompany gastritis pain. Additionally, warm water doesn't shock your digestive system the way cold water does, allowing your stomach to maintain its natural rhythm and function without the disruption that can worsen inflammation and delay healing. To achieve the optimal temperature, you can heat water in a kettle or microwave until it reaches the desired temperature, which you can test by dipping your finger into the water. It should feel warm and soothing, but not uncomfortably hot. Alternatively, you can mix hot water with room temperature water until you achieve the right warmth. The key is consistency. You want to drink water at this therapeutic temperature every single time you consume liquid for gastritis relief, because the cumulative effect of proper temperature over time is what creates lasting healing benefits. The second principle involves strategic timing that takes advantage of your digestive system's natural cycles and avoids the common timing mistakes that can worsen gastritis symptoms. Most people drink water randomly throughout the day, without considering how the timing of liquid consumption affects their digestive processes. But for people with gastritis, especially those over 40, timing can make the difference between healing and continued irritation. The most therapeutic time to consume your warm water is approximately 30 minutes before meals, when your stomach is empty and can fully benefit from the healing effects of the warm liquid without interference from food or digestive processes. During this pre-meal window, the warm water can directly contact and soothe your stomach lining, reduce existing inflammation, and prepare your digestive system for optimal function during the upcoming meal. The 30-minute timing ensures that the water has adequate time to provide its therapeutic effects without interfering with the concentration of digestive juices that will be needed to break down your food. The second optimal timing for therapeutic water consumption is approximately 2 hours after meals, when the initial stages of digestion are complete, but your stomach may still be experiencing residual inflammation or irritation from the digestive process. Consuming warm water during this window provides soothing relief from any post-meal discomfort, while supporting the continued healing of your stomach lining during the periods between active digestion. One of the most crucial aspects of timing is avoiding liquid consumption during meals and for at least 1 hour after eating, because drinking during or immediately after meals dilutes your digestive juices and interferes with proper food breakdown, especially important for people over 40 whose digestive capacity is already naturally reduced. This timing discipline requires some adjustment for most people, but the improvement in digestive comfort and gastritis symptoms is typically noticeable within just a few days of implementing proper timing. The third principle of the therapeutic water technique involves specific consumption patterns that maximize the healing benefits while avoiding the stomach distension and discomfort that can occur when large amounts of liquid are consumed too quickly. Instead of drinking large quantities of water at once, which can overwhelm your stomach and trigger painful stretching of already irritated tissue, you're going to consume smaller amounts using a specific rhythm and method that allows your stomach to gradually absorb the healing effects of the warm water. The optimal consumption pattern involves drinking exactly 4 ounces of warm water, which is about half a standard cup, and consuming it slowly over the course of 5 to 10 minutes, using small, deliberate sips that allow you to focus on the soothing sensations as the warm liquid coats your stomach lining. This slow consumption method serves several important purposes for gastritis healing. First, it prevents the sudden volume expansion that can cause pain and discomfort in an inflamed stomach. Second, it allows the warm temperature to have maximum contact time with your stomach lining, providing sustained soothing effects rather than brief relief. Third, the mindful, slow consumption activates your parasympathetic nervous system, which is essential for optimal digestive function and healing. During the consumption process, sit in a comfortable, upright position and focus your attention on the sensations in your stomach as you drink. Notice how the warmth feels as it enters your stomach. Pay attention to any changes in pain or discomfort, and breathe slowly, and deeply between sips to enhance the relaxation response. This mindful approach to water consumption transforms a simple act of hydration into a therapeutic healing practice that addresses both the physical and emotional aspects of gastritis management. But the therapeutic water technique becomes even more powerful when you add specific healing compounds that work synergistically with the warm temperature and strategic timing to provide enhanced anti-inflammatory and tissue healing effects. The first addition that I recommend to all my gastritis patients is a pinch of high-quality sea salt, approximately 1/8 teaspoon per 4 ounces of warm water, which provides essential minerals that support proper stomach function while helping to balance pH levels and reduce excessive acidity that can worsen gastritis symptoms. The sea salt also helps your body actually absorb and utilize the water at the cellular level, because pure water without electrolytes often passes through your system without providing adequate hydration to healing tissues. The mineral content in sea salt supports the natural healing processes in your stomach lining while providing the electrolyte balance that's necessary for optimal cellular function and repair. The second therapeutic addition is 1 teaspoon of raw honey, which contains powerful anti-inflammatory compounds, natural enzymes, and antimicrobial properties that can help reduce gastritis inflammation while providing gentle energy that doesn't stress your digestive system. The honey should be raw and unprocessed to retain its therapeutic properties, and it should be stirred into the warm water until completely dissolved. The natural sugars in honey are easily absorbed and don't require intensive digestive effort, making them ideal for providing nourishment to healing stomach tissue without causing additional irritation. The third optional addition, which can be particularly beneficial for people with severe gastritis symptoms, is 1 tablespoon of pure aloe vera juice, which contains specialized compounds called polysaccharides that have been scientifically proven to reduce inflammation, promote tissue healing, and provide protective coating effects for irritated stomach lining. Aloe vera has been used medicinally for thousands of years, and modern research has confirmed its effectiveness for treating various digestive disorders, including gastritis, ulcers, and inflammatory bowel conditions. Now I want to pause here and ask you a very important question that will help me understand which aspect of this therapeutic water technique resonates most strongly with your current gastritis experience and symptoms. Based on what I've shared so far about temperature, timing, and consumption patterns, which element do you think will make the biggest difference in your daily gastritis management? Are you most excited about switching from cold to warm water and experiencing the immediate soothing effects on your inflamed stomach lining, implementing the strategic timing approach that avoids the common mistakes of drinking during meals, learning the mindful consumption method that transforms hydration into a healing practice, or adding the therapeutic compounds that enhance the anti-inflammatory and healing properties of your water? I want you to write in the comments like this: I'm most looking forward to trying, and then share which aspect of this technique appeals to you most and why you think it will be particularly helpful for your specific gastritis symptoms. Your response not only helps me understand what information is most valuable to people dealing with gastritis, but it might also help other viewers identify which components of this technique could provide the greatest benefit for their individual situation. The remarkable thing about this therapeutic water technique is that most people experience noticeable improvements in their gastritis symptoms within the first 24 to 48 hours of implementation, and the benefits continue to compound over time as your stomach lining receives consistent, gentle healing support throughout each day. Many of my patients report that the warm water provides immediate relief from burning sensations and stomach pain, often within minutes of consumption, and this immediate feedback helps reinforce the practice and makes it easier to maintain consistency. However, the most significant benefits of this technique become apparent over the course of several weeks, as the consistent application of proper temperature, timing, and consumption patterns allows your stomach lining to begin the genuine healing process that's been disrupted by years of incorrect hydration practices. The warm water helps increase blood circulation to your digestive organs, delivering more nutrients and oxygen to healing tissues, while helping to remove inflammatory waste products that contribute to ongoing irritation and pain. The strategic timing ensures that your digestive system can function optimally during meals while receiving therapeutic support, during the periods between eating when healing and repair processes are most active. The mindful consumption pattern helps retrain your nervous system to associate hydration with healing and relaxation rather than stress and discomfort, creating positive psychological associations that support the physical healing process. For people who have been dealing with gastritis for months or years, this technique often represents the first time they've experienced consistent, reliable relief from their symptoms without relying on medications or dramatic dietary restrictions. The simplicity and accessibility of the method makes it easy to implement even for people with busy schedules or complex health situations. And because it uses only natural approaches, there are no side effects or interactions with medications to worry about. It's important to understand that while this therapeutic water technique can provide significant relief and support healing for most people with gastritis, it works best when combined with other appropriate lifestyle modifications and medical care when necessary. The technique addresses one crucial aspect of gastritis management, but comprehensive healing often requires attention to diet, stress management, sleep quality, and other factors that influence digestive health. For people who are currently taking prescription medications for gastritis or acid reflux, this water technique can be safely implemented alongside conventional treatments and may actually enhance the effectiveness of medications by providing additional healing support and reducing the overall inflammatory burden on your digestive system. However, as your symptoms improve and your stomach begins to heal, you may find that you need less medication, and any changes to prescription regimens should be discussed with your healthcare provider. The technique can also be modified based on individual preferences and tolerances while maintaining the core principles that make it effective. Some people prefer to add a small amount of ginger to their therapeutic water for additional anti-inflammatory benefits, while others find that a few drops of lemon juice help with palatability without compromising the healing effects. The key is maintaining the fundamental elements of warm temperature, strategic timing, and mindful consumption, while adapting the specific details to work within your personal preferences and lifestyle. For people who travel frequently or have unpredictable schedules, the technique can be adapted using portable methods for heating water, such as small electric kettles, immersion heaters, or even requesting warm water from restaurants and cafes. The consistency of the practice is more important than perfect execution in every situation, and even maintaining the technique most of the time while occasionally adapting it for practical circumstances will provide significant benefits compared to continuing with harmful hydration patterns. One of the most important aspects of successfully implementing this therapeutic water technique is developing awareness of how your body responds to different hydration approaches and learning to recognize the subtle signs that indicate healing progress. Many people with gastritis have become so accustomed to daily discomfort that they don't immediately notice when their symptoms begin to improve. So keeping a simple journal of your daily symptoms, water consumption patterns, and overall digestive comfort can help you track progress and stay motivated to maintain the practice. Pay attention to changes in the intensity and frequency of burning sensations, improvements in your ability to eat various foods without triggering symptoms, better sleep quality due to reduced nighttime digestive discomfort, and increased energy levels as your digestive system functions more efficiently. These improvements often occur gradually over several weeks, and documenting them helps reinforce the value of maintaining consistent practice even when dramatic changes aren't immediately apparent. It's also worth noting that this therapeutic water technique often leads to improvements in other aspects of health beyond just gastritis symptoms, because proper hydration and improved digestive function support many other bodily systems. Many people report better skin health, improved mental clarity, more stable energy levels throughout the day, and better immune function as their digestive healing progresses and their overall health improves. The technique also helps break the cycle of anxiety and stress that often develops around eating and drinking when you have gastritis, because having a reliable, natural method for managing symptoms provides a sense of control and confidence that reduces the fear and anticipation that can actually worsen digestive problems. This psychological benefit is often just as important as the physical healing effects, because chronic health conditions can create emotional stress that perpetuates the very symptoms you're trying to resolve. For people who have tried numerous other approaches to managing their gastritis without success, this therapeutic water technique offers hope because it addresses fundamental physiological processes that support healing rather than just masking symptoms or avoiding triggers. The method works by supporting your body's own natural healing mechanisms rather than interfering with them, which is why the benefits tend to be sustainable and continue to improve over time, rather than requiring escalating interventions. Many of my patients who have successfully implemented this technique report that it becomes a cherished part of their daily routine, a few minutes of peaceful, intentional self-care that provides both physical relief and emotional comfort. The practice of mindful therapeutic hydration often becomes a form of meditation that helps manage stress and anxiety while directly supporting digestive healing, creating multiple benefits from a single simple practice. If you found this information about the therapeutic water technique helpful, and you're ready to experience the relief and healing that proper hydration can provide for gastritis symptoms, I want to encourage you to subscribe to this channel right now and activate the notification bell, because I regularly share advanced gastroenterological insights and specific therapeutic techniques that can help people over 40 manage and heal from digestive disorders naturally and effectively. This channel is dedicated to providing the kind of detailed, practical medical information that empowers people to take an active role in their healing process and achieve results that go beyond what conventional treatments alone can provide. I also want to encourage you to share this video with anyone in your life who struggles with gastritis, acid reflux, or other digestive problems, because this simple technique has the potential to provide immediate relief and long-term healing for people who may have been suffering for years without knowing that such an effective natural solution exists. Your sharing could literally transform someone's daily experience and help them reclaim their quality of life from chronic digestive discomfort. Thank you for taking the time to learn about this powerful therapeutic water technique, and for trusting me to guide you toward natural healing solutions that work with your body's own healing capacity. I'm confident that if you implement this technique consistently and patiently, you'll discover that something as simple as changing how you drink water can make a profound difference in your gastritis symptoms and your overall digestive health and comfort.